During pregnancy, especially in the second and third trimesters, sleeping comfortably becomes challenging, and back pain is common. Choosing the right sleep position can help reduce discomfort and improve blood flow to both mother and baby. Sleeping on your left side is the safest and most comfortable position during pregnancy. This position improves blood circulation, reducing pressure on the lower back, uterus, and liver. Bend your knees slightly and place a pillow between your legs for spine alignment. Use pregnancy pillows for added support. Place a small pillow under your belly for support. Elevate your upper body if you have heartburn. Use a wedge pillow under your side for support. Avoid sleeping on your back after 20 weeks as it can compress a major blood vessel. Sleeping on your stomach is not recommended after the first trimester due to discomfort. Use a firm mattress, do gentle prenatal stretches or yoga, and take a warm bath to relax muscles.